So I started the hospital medicine job in 2015, and so it's been almost 8 years now, like 3 years longer than I was in primary care. Very, very different beast from primary care, and quite a few disadvantages too. At first I really didn't like it at all, and I'll make a different video about exactly what my transition was like, but I've been there for 8 years, so I like it enough. What I think are the pros of hospital medicine. Number one is the shift nature of the job. This was the thing that I was looking forward to the most, was to be able to actually completely leave work. That part is really cool. I can completely leave work. I just work days. We happen to have a full-time nocturnist team, so that's very nice. None of the daytime people have to work nights if they don't want to. The days can be pretty long, but when I'm done, I'm completely done. I log out, I forward my messages, and that's it. People aren't going to call me at home. I don't have to take call. So when I'm done, when I'm off, I'm completely off. Another thing that's really nice is you've got your resources right there. When I worked in the clinic, I would say, I need these labs to be done. I need this ultrasound. I need this x-ray. I need this scan. And I would write the order for the patient, and maybe they'd get it. Maybe they wouldn't. Maybe they would follow up. Maybe they wouldn't. And sometimes that can be a little bit frustrating if you are a little concerned about a patient. You really want them to get the labs, get the x-ray. It's up to them. They walk out of the door, you may never see them again. But in the hospital, they live there. So if I order some labs, especially if I order them stat, within a couple hours the results are back. That's really nice. If I need a scan, if I need an ultrasound, all those things are done right there. Even an MRI. So you get your diagnostics quickly, so you can move forward with your workup and your management. That part's good. And along those lines, you also have quick access to consultants. That part is really, really nice. If I wanted a patient from clinic to see a consultant, they'd have to make an appointment, and that would take a couple months. They may never get a chance to do it. It just can fall through the cracks. But in the hospital, I see who's on call. I call the consultant. They see the patient. They let me know. They drop a note. It's fantastic. And we have access to a wide range of consultants. Not as many as I would like, but the really, really critical ones are there. There's a wonderful mystery-solving component that I like about it, and there's a lot of detective work that we need to do. So when people come in acutely ill or with some kind of symptom that's really alarming, and sometimes it can be really confusing as to what it is, and the hospitalist job is really the diagnostician. Obviously, we need help from specialists, but ultimately our job is to reach a diagnosis as best we can. So that involves a lot of mystery solving, and that part is really attractive to me. That's the one thing that still kind of gets me really excited to go to work. You have to memorize a lot of rules, but if you know the right questions to ask and where to find the information, you can get the answer. And it really is true. I'm sure you've heard the saying, the patient tells you what they have. And it's true, they do. But you really have to know which questions to ask and where to get the information. But that comes with experience. There are quite a lot of things that are kind of a drag in hospital medicine also. You remember how I talked so much about how I enjoyed trying to prevent disease, trying to promote health? There isn't any of that. Basically, if somebody's sick enough to be admitted to the hospital, the time for prevention is over. They're pretty sick. There's definitely elements of patient education, but it's kind of a drag that there's no disease prevention per se. Even though we're not preventing disease, though, we are doing something very important for the patient, because oftentimes if someone's hospitalized, it's a big deal. The patient and especially their families are often very worried I get to kind of guide them through a very scary and uncertain time. If things are not going well, I get to respectfully and gently walk the patient and their family through what might be a very difficult time. If a person is getting worse, or if a patient is going to die, I get to kind of guide them through that. Obviously, it takes compassion, but knowing the right way to communicate and phrasing things is pretty critical. Another thing that's kind of a drag, which may be a deal breaker for some people, is the acuity can be really high. People can get really sick really fast. They can decompensate quickly. Sometimes patients die on you, or they try to die. Some people aren't comfortable with that level of acuity. Personally, I'm not much of an adrenaline junkie, so I prefer deliberate, methodical mystery solving. I like that. And I'll just touch on one point that's kind of a drag here, is disposition. Now, if you do this job, you know exactly what I'm talking about. When you're in clinic, the patient walks in, they walk out. Presumably, they have a place to go. They're able to take care of themselves. In the hospital setting, you have to manage every aspect of the patient's life, more or less. When they're getting stable enough to leave the hospital, where they go after the hospital is a gigantic part of the job that involves little to no medical knowledge, but ends up being a gigantic part of your day, and often a huge headache. I'll talk more about that in a future video, but that is a big drag in terms of how much time it takes and how unfulfilling it is. So that's most of what I like and dislike about my current job. In an upcoming video, I'm going to talk about exactly what my transition was like, why I was very lucky to have started in primary care. It really prepared me well for hospital medicine. I don't think it's that difficult of a transition. I would say overall, I'm pretty happy where I am. I don't like the job as much, but I like the lifestyle a lot better. Even though I don't get to practice wellness or prevention of disease, I do interface with people at a very difficult and scary time. And I get to help people in a very acute and rapid fashion. And sometimes you can help save someone's life, and that's a nice feeling. Please tell me what you think in the comments.